Hi, I'm Dr. Arash Hakhamian. Welcome to Dental Heroes. Today's episode is featuring one of the best cosmetic dentists in the world and one of the premier dentists in Beverly Hills, Dr. Joseph Goodman, who has blessed us with his presence. Welcome.
Thank you for having me. Thank you.
Thank you. Thank you for coming. I'm so excited about speaking to you, about talking about not only how you're changing the lives of your patients, but how you're one of the trendsetters and leaders in dentistry, the technologies that you use. I know you practice all over the world. Most dental offices, most dentists have an office in a local area. You're international, from Germany to Dubai to Beverly Hills. So welcome. And I want to talk a little bit about first your history. Why did you get into dentistry, and how long you've been doing what you're doing, and what excites you, and why are you so motivated to expand your reach and serve millions around the world?
Yeah. So my father was a medical doctor. So I was always born with this medical dental in this environment and this field back in Germany. But what fascinated me about dentistry, that the results are oftentimes instant, right? So you go in and you leave the office and you can have a transformation, whether it's a smile transformation, a health transformation, a silver filling change into a white filling, gum disease into a healthy gum, almost instantly. And that is really exciting. So that was really fascinating to me. And that's why I thought this is, and it's also very hands-on, of course, right? Versus medicine. Oftentimes you just prescribe something or talk to the patient. This one is hands-on. You're in the mouth, you're working, you're creating something. So there's a lot of fun aspects into dentistry, and that's why I chose this route.
Well, they say dentists are part scientist, part doctor, part
mechanics,
part engineer, yeah, and part artist. Exactly.
Part mechanics. That's true. Yes, and it's interesting. So, for example, oftentimes I see the mechanics of dentistry is wrong. So, for example, you have two missing teeth, right? So when you have two missing teeth and you place a bridge, you need to have the adjacent teeth to be used as an anchor to replace the missing teeth. The
Correct.
Replacing teeth are called pontics. The teeth which are stabilizing the bridge are called abutments. So how many abutments do you need and how many missing teeth, right? I sometimes see dentists placing 6, 7 abutments to replace 2 teeth. So it's a big bridge.
Yeah.
Right? It's an overkill. It's an over mechanic. Why? Because you can't floss in between these teeth. So there are like 6 teeth now in one block that you can't floss. It inhibits your gum health. And it goes back to engineering, right? You don't have to over-engineer. You don't have to connect 5 or 6 teeth to replace 2 teeth. There's a mathematical formula how many teeth you use as an abutment and as a pontic. So yes, they are indeed engineers.
It's amazing. I think quite a while back there was I don't remember if it was a New York Times or one of these outlets. They send the same patient to 10 different dentists, and guess how many different opinions they got?
I hope not more than one.
every single one had their own opinion. So same patient sent x-rays. And so there's such a lack of standardization in dentistry, and everything is opinion based on your experience and based on your comfort level. So it's really intriguing to see experts and how their brain works and why they are doing what they're doing and what they recommend. So kind of breaking that down and seeing the reasoning behind this and the rationale is really interesting. But yeah, to your point, you go to a dentist and sometimes they're shaving down multiple teeth, where sometimes another dentist would say, we're not going to shave any teeth. We're going to place
an implant, of course. And implants are so mainstream right now. There is no reason why any dentist should not offer these services to his patients, right? So implants are biocompatible. They're made of titanium. How do we know? When you have a hip replacement and you need titanium screws and anchors, what do you use? Titanium, right? So it is biocompatible. It is strong. And it works really well. 97% success rate. Not bad.
Not bad at all.
Not bad at all, right?
So tell me about biocompatibility and why that's important. What is biocompatibility? Why is it important? How do you ensure or try to aim for as high a biocompatibility as possible?
Yeah. So I'm a cosmetic dentist. I'm a general dentist. So as a general dentist, we use materials in the mouth, of course, fillings, crowns, implants we just talked about. And we use a lot of different materials. And these materials, let's say fillings, right? A filling is placed. It takes me 30 minutes to place a filling. It can stay in your mouth for 7, 8, 9 years. right? So you really want to make sure that this filling, which stays in your mouth for 8-9 years, which is in constant contact with your body, right? You swallow all the time, hundreds of times a day, thousands of times a day. You eat hot food. It goes right into your body. So why is it important? It's because this is something permanent. This is not like a quick patch and it goes away. It stays in your mouth for potentially 10, sometimes even 20 years. Sometimes I do veneers, right? They last 20 years. They're 20 years in your mouth. So what is important, for example, fillings, right? When you have cavities, you fill them with a filling material. I don't use amalgam. Amalgam has 50% mercury. So we use something called composite, right? Composite is a plastic-like material. It has what? BPA, bisphenol A. And I like to stay away from bisphenol A. It's an estrogen inhibitor, and it changes the estrogen in a person's body, can lead to more diseases, right? Very complex biochemical structure. So we use BPA-free material. Bisphenol A is something that you have to avoid wherever you can. It is the inside of plastic bottles, the can, the plastic, the wraps.
Yep.
They now say it's even in the McDonald's wraps, the food, the coffee.
Your cups, everything.
Yeah. So you think you're holding a paper cup. Oh, paper is better. It's not plastic. It's more biocompatible. It's environmental friendly. But guess what? The inside is not paper. If it was paper, it wouldn't stay.
Correct.
The liquid wouldn't stay in there. So obviously there is some sort of lining, which is called BPA, a lining that will make it stay inside and not melt. So that's very important. So another important thing is called ozone. So there's, of course, certain methods that we have to irrigate the gum to kill the gum bacteria, right? Chlorhexidine is a very popular one, but it's a chemical, right? And what we use is ozone. It's oxygenated water. It's very powerful, antiviral, antibacterial, and antifungal. It's water with the 3 oxygen molecules, and it kills all virus, bacteria, and fungus in your mouth. So you use it to irrigate the mouth when you do root canals, when you do gum disease treatment, when you do gum cleanings, pretty interesting.
Yeah.
And if you drink it accidentally or swallow it, guess what?
Nothing happens.
Nothing happens. That's water and oxygen.
So I want to break that down because you touched on a lot of good points. So first of all, the mouth, newsflash to everyone who didn't know, the mouth is connected to the rest of your body, right? So what happens here has an impact on your health. So you're swallowing, as you mentioned, your saliva, things that are in the mouth go into the bloodstream from your mouth. You're inhaling this and it's going into your lungs. So the types of materials and chemicals that we use in the mouth can leach into other parts of the body, correct?
Very correct. And one very contributing factor when we talk about bacteria in the mouth, they have been found in your heart. So if you have heart disease or if you don't have heart disease, it can contribute to symptoms because these bacteria are very specific. They're, of course, in your mouth, right? And they found that when you dissect a patient's heart, those bacteria are found in the patient's heart.
And brain.
And brain. So very important. Oral health can lead to your overall health.
There was a study on Alzheimer's and dementia patients who had already passed. And they dissected their brain and they found that 96% of these patients had oral bacteria in their brain. Gingipains from P. gingivalis had traveled through their bloodstream, crossed the blood-brain barrier, and ended up causing local inflammation in the brain. So the bacteria can obviously impact and they travel. This is the biggest orifice that you have, in your body. But also you touched on longevity. So every single time we have to shave the tooth down, right?
Yes.
You get closer and closer to the nerve. You have to shave more of your tooth structure. So doing something minimally invasive at the beginning and using the right material that will last longer. Tell us about how do you think about that when you're treatment planning someone, when you're performing the procedures? How do you decide what material is best? And what are the things that go on in your head?
Yeah. So generally speaking, what is a very popular treatment in dentistry when you have a large cavity, a large defect or broken tooth, it's called a crown, right? A crown or cap covers the entire tooth, right? So you protect the tooth with a material that can be gold or porcelain, and it protects it and you remove the cavity first, obviously. But when you do a crown, you obviously have to shave a lot. Bad tooth structure and healthy tooth structure. So what I like to do is a modification of a crown. I oftentimes do half crowns, inlays, onlays, 3/4 crowns, 7/8 crowns. You can be very creative. What is the point? The point is you want to preserve the good tooth structure. Don't file the entire tooth. What is good, leave it untouched. And the bad tooth structure portion is removed and replaced with a crown material. So it's a crown material, but it doesn't cover the entire tooth. So you can call it inlay, onlay, 3/4 crown, 7/8 crown, whatever you like to call it. It is definitely a better approach versus shaving too much. Every time you shave too much, you irritate the tooth too much, and every time you irritate the tooth too much, you may lead into a root canal. So less shaving is always better.
It's incredible to see dentists that follow what's in the best interest of the patient, and then dentists that follow what the insurance covers. And it's really important to note that what the insurance covers may not always be in the best interest of the patient. So I've had patients where we want to conserve that tooth structure for an inlay, onlay, 3/4 crown, but the insurance says, we don't cover that. We only do extraction or full coverage crown, but full well you would have to shave the tooth down more than you would be required. So how do you communicate that with your patients?
Well, it has a little bit to do with the fact. So in my area, we are in West Los Angeles, patients, we spend more time with the patient. It's not like a factory, in and out and open. And, you leave the office, don't even know what happened and what material was used, right? There was no informal consent, So when you practice in a certain area of Los Angeles and West LA and Beverly Hills, you spend the time to talk to the patient, you communicate, you explain, and you let the patient decide. Right? So you tell the patients, here are your options, here are the materials we have available, here are the prices, you choose, right? I'm not the one who says do the most expensive one. I'm not the one do the most cheapest one. You decide. And oftentimes, more than oftentimes, patients say, what, after everything you explained to me, I appreciate that. Let's go with the porcelain onlay. I like something stronger, more biocompatible, healthier. And of course, porcelain lasts longer than plastic because, it's a stronger material. So it's all about communication, conversations, explaining patients, and let them make their choice.
Right. So you talked about mercury fillings,
Yes.
Known as amalgam fillings. So one of the things we had to do when my father was practicing was, in order to put one of those things in, you have to shave the tooth down a lot. Because if they're thin, you have to wait almost till the cavity gets bigger. And you have to shove a lot of this because it hardens. And those expand over a period of time. They tend to fracture the teeth. You start to see the teeth changing colors from the mercury leaching into the tooth. But so they transitioned into white fillings.
Correct.
They said white fillings are great. But from what you're telling me, you also have to be careful with white fillings because they're plastic. And
they have chemicals, and there is bisphenol A, and you have to make sure that the fillings you use are bisphenol A free. And if the plastic fillings are too big, you want to maybe change to gold or porcelain instead, right? They can be a filling, but it could be porcelain or gold, and gold fillings are amazing. When I was a dental student in Germany, I used to have a landlord who was my dentist. He was one of those old-time dentists that, and so I went to him and he said, you have a cavity, we need to fill it, right? And what did we use? Gold inlays, gold fillings, right? They're fine, they're back. And I was, of course, opposed to it. I'm like, I don't know about that because I was, 20 years old. And he says, and he was very strong, alpha personality, he says, don't worry, you'd be happy. And I'm like, are you sure about that? Now, I was 20 years old. I was a dental student. I'm now 50 years old and they're still in my mouth.
Yeah, they last forever.
They last forever.
Yeah.
If done correctly, they last forever. And guess what? Nobody ever has said, oh, you have a gold filling in your mouth, because they're far in the back. They're on the chewing surface. Obviously, they're not like veneers that you see from the facial. Obviously, they're not on the side of the teeth. They're literally on the chewing surface. 30 years.
Right.
30 years. Actually, coincidentally, a year ago, I was chewing gum and one of those came out.
After 30 years.
After 30 years.
Yeah.
And I'm looking at it and it looked perfect. So I had my assistant cemented, so I'm like, we used a sandblaster on the inside. She knows how to apply the cement, and then she applies it and boom, it's back in the mouth. Same onlay, 30 years later, it was perfect. I would have taken a new impression and done a new one if I had to, but I didn't have to.
That's right.
Now, it's expensive because gold is expensive, right? And it's not, and it's not for everyone. I understand, but there's options available.
But I think it's initially more expensive, but in the long term, if you calculate these white fillings that have to be changed every 5 to 10 years,
Absolutely.
after 3 or 4 rounds of that, you're going to end up with a root canal. You're going to end up with a crown. So long term, I think actually gold inlay or onlay probably is going to save you thousands of dollars and maybe save your teeth.
Yes. And the reason they save your teeth is because any dentist who will tell you, I don't touch the tooth and I don't shave more tooth away.
Sure.
It's not possible. We have magnification, we have loupes, we have microscopes, but still, the human person, you drill a filling out, you always accidentally or not accidentally remove some healthy tooth structure. There's no way around it, right?
There's no way around it.
And it's not a big deal, no problem. And then 6, 7 years later, you do the same thing again, a little bit bigger, and all of a sudden it becomes a crown. So if you can use a better material such as porcelain or gold, you leave it in there for hopefully more than 10 years. You don't touch the tooth for 10 years. Better for you, better for the tooth health.
So let's talk about something really important that you touched on so that patients understand from the beginning that nothing is forever. I mean, it's amazing that we use, so many different, think about your tires. You buy brand new tires, brand new car. Do you expect that to last forever? There's wear and tear. So patients, I think, have to understand that not all your fillings are going to last forever. You're going to have to change these frequently. Yes, you got it 5 years ago, but the things that determine the longevity of that is quality of materials, how well you take care of it. I mean, you have to be involved in the maintenance process, and then the expertise of the person who's actually doing the procedure. It's multifactorial.
And your grinding factor. Everybody is different, right? A small little lady, has probably less grinding and less forces, and the muscles are less strong than, for example, a big athlete who is intense, alpha personality, stressed out in his life. Grinding, chewing, grinding, bruxism, all of these contribute to failure of dental material.
Correct.
Of course.
Correct.
Absolutely. And there's no control. You have to wear a night guard, by the way. The night guard is made out of what?
Plastic.
And we want to avoid what?
Plastic.
BPA. And so we have to make sure the plastic night guard is free of BPA.
Correct. So not all fillings are the same, and not all night guards, not all materials are the same.
Absolutely, yes. Yeah. So BPA, what it does is actually makes the filling softer, and it makes it easy for the dentist to mold. So a filling is almost like a soft material. You place it inside a tooth, you mold it, you shape it, you design it, and then you use a blue light and it cures it, right?
It hardens it.
It hardens it. Exactly. So you want a material which is really plastic-like. You can form it easily, and then before you cure it, right? So you can easily manipulate it or easily work with as a dentist, right? So fillings without BPA are a little bit stiffer and a little bit more difficult to work with. They don't have that same elasticity. They don't work so well in the hand of a dentist. You can mold them easily. So it takes a little bit of effort and time and learning. It's a learning curve, right? But the materials are fantastic. They last the same, if even better and longer. But you need to learn how to apply these materials when you don't have these chemicals like BPA. And
So let's talk about the evolution of dentistry. So I've been, I pretty much was born in a dental office, and I've seen dentistry evolve in many ways in positive direction, in some ways, in a not so positive direction. But we went from basically extracting teeth. As soon as there's an issue, we just pulled it, right? So we see the consequences of pulling teeth. Teeth are shifting, the bite changes. You start putting more pressure on adjacent teeth. You start to see cracks and fractures in adjacent teeth. Then we went into removable appliances like partial dentures and dentures, which have a whole series of issues I want you to talk about. And then we went into bridges, which don't come in and out, but you have to shave additional teeth, the adjacent teeth. Now we're at implants. Where do you see the future of dentistry? Is it just prevention? Is it reversing cavities if you catch it early on? Tell us, where do you see, with such ample experience, where do you see dentistry going in the next couple of years?
Yeah. So just to follow up on your conversation, so I have a feeling that right now there's a trend going on where we're going backwards. Yes. So what does backwards mean? So there is a way to save a tooth with effort and work. You do root canals, you do some gum surgery called crown lengthening, you do crowns, you're absolutely correct. You do some gum cleaning, and you can fix a tooth. But lately there's a trend where we are reversing everything and it's too much work and too much time to do this, to save this, to do all of these specialty works, right? A gum surgery, a root canal, a crown. It almost needs like 3 dentists or 3 specialists, right? Endodontist, periodontist, and a restorative dentist. So what happens lately is we're going back to extract and do all on fours, right? So what does that mean? You basically remove all your teeth, bad ones, mediocre ones, good ones, whatever, because you can't do all on 4 without.
Take them all out.
You have to take them all out, right? And then you place 4 implants, right? And you place a denture that is screwed onto those implants. So the idea is the denture is, yes, it's a denture, but it's fixed because it's screwed onto those implants, so it's not removable, right? So imagine you have beautiful teeth now all of a sudden, and they're anchored on 4 teeth. But there's a problem with that. So it's like a chair with 4 legs, right? 4 implants, 4 legs. So what happens if one leg is missing? Oops.
Nothing.
Well, the whole thing can fall apart,
That's
right?
right.
So now you can't have a denture with 3 teeth and all of a sudden the denture becomes loose. But so what I'm trying to say is I see patients in my office, they come in not that old, 45, 50, end of 30, with no teeth. And what happened?
Horrible.
Well, my dentist said, pull all your teeth. It's easier. Just do the denture.
Yeah.
And again, there is a place for that called all on 4. I prefer all on 6, by the way, which means you place 6 implants. So if you have 6 implants and 1 fails, you still have 5. But if you have 4 implants, of course, you're in trouble when you have a failure. And it's non-reversible. Teeth are out.
Correct.
Now you're stuck with the denture and your implants. And if something goes wrong, then you have a problem. So what is the future? The future is reversing cavities, or maybe even better, preventing cavities to begin with a supplement that inhibits the biochemical changes from sugar to decay.
Yeah.
So a supplement that you have that you can use after you eat, and you just prevent cavities to begin with. That is the future. And reimplanting teeth, by the way, instead of implants.
Stem cells.
Using your own teeth to grow your teeth, which is amazing.
There's one procedure in dentistry that I have never done and I will never do. It is called all on 4. I absolutely refuse. So I've taught surgery. I've trained thousands of dentists. I was one of the founders of a company called Global Dental Implant Academy. We would train dentists how to place implants. And what we would say is all on 4, none on 3. Right? So to your point, if, implants, just because it's not a tooth doesn't mean it's going to last forever. And there's a rate of implant failure for, changes in the microbiome, diabetes, things that change over time. And one of those implants can fail. So at the very least, I love to hear that you put 6, because should something happen to one of those, the entire thing isn't gone. But also to put all on 4, you have to remove all of these teeth and then remove tons of the jawbone to make enough room for this bridge.
Correct.
Right?
Correct.
Irreversible.
That's why when I see patients who have teeth which are slightly mobile or even mobile, you can save them.
That's right.
You should save them.
Good.
I've seen patients with baby teeth, and they come to me and says, my last dentist said I should remove them. Okay. We look at the x-rays, and indeed the roots are very short, like almost like super short, right? Okay. You look at this tooth, you hold it with your 2 fingers, you try to move it. It doesn't even move. The baby tooth doesn't move. They come back 4 or 5 years later, the tooth is still in place.
Right.
So just because it doesn't look right in an x-ray, or just because it doesn't make sense why a 35-year-old lady or a man has a baby tooth, why not?
Yeah.
Let him have his baby tooth.
I have a challenge.
Yes.
I've still have never met a single dentist around the world, anywhere, and I challenge dentists, please be the one that proves me wrong. I've never seen a dentist with all on 4. Not one.
Oh, himself?
Yep, never. So it's amazing that we can so readily. I mean, there's offices that specialize in just doing all on 4. You walk into this office, there's about a 95% chance that all on 4 is going to get recommended to you. So I love to hear from dentists like yourself that are saying less is more. Let's slow down. Let's talk about your options. Let's figure out a strategy to do less. And keep it minimally invasive. And so I think this is why you have TV celebrities. You have, was it Miss America was one of your patients?
Well, yeah, I work with the Miss USA.
Miss USA.
Miss California. the local beauty pageants, the beauty queens.
Tell us a little about that. Everyone wants to be the cosmetic dentist of the stars, but really it's beyond that. There's trust. These people do their homework and they look for someone who not only can provide beauty, but also is focused on materials, is focused on minimally invasive care. Tell us about the experience in working, with this type of population, and then is that the same way that you treatment plan the general population?
Mm-hmm. Yes. So, obviously, when you are competing for Miss California or Miss USA, you're more beauty oriented, right? So your focus is veneers, whitening, beautiful teeth, sparkling white teeth, Invisalign, straight teeth. So it's a different focus, right? You tell Miss California, you have a cavity. I'm like, oh yeah, let's get to that later. Let's just focus on the front, right?
Right.
So the experience is, everybody has their needs and desires and what they are really looking forward to get done. But you are right. They can choose any dentist.
So this is who is this? Miss California?
This was Miss California 2015, actually. So it was already 5-6 years ago. And she has a beautiful white smile and,
And then I see Pierce Morgan. I see
Dr. Phil.
Dr. Phil.
So that was an amazing experience. So Dr. Phil, when he had this show here in Los Angeles, before his we don't call him patients, we call him the audience or his guests would go on TV and speak about their experiences. They would send them to us, make them camera ready. Sometimes we only had a few days. It's a very short. So they fly out. And they say, Dr. Goodman, just fix them up, make sure they're camera ready. And then they go to the studios and talk to Dr. Phil about their problem. So I fix their teeth problem and he fixes their psychological issues. So it's a fun experience because sometimes it's short notice and you have to be very creative, right? So you don't have sometimes time to send the case to the lab and make it into a smile makeover. There's no 2 weeks time. The patient comes in and tomorrow there's a show.
That's right.
Right? So that was a great experience. And patients still are following me on Instagram and social media and they say, thank you. I'm like, oh, for what? I don't remember you, right? Because he's not a regular patient. He's already back to, Montana, where he came from, for example. Oh, 7 years ago, you fixed my teeth.
You changed my life.
I came to you. Dr. Phil sent me to you. They took care of the bill. My teeth are still fine. And I will not forget. I'm like, wow, what a nice statement. 7-8 years later, I forgot because I remember patients I see every time, routinely, right? Yeah. So when I see them every 6 months, I can address them by their first name, but I did not remember that patient. And I had to ask, where did we meet? How do you remember me? How do you are so grateful? 7-8 years ago, I was on the show. I came to your office. You took care of me and my teeth are still functioning well. So very grateful for that experience.
It's interesting because we shifted into this dentists can transform your life, right? We talked about transforming confidence, getting a job, being able to speak and chew properly. So truly, that's a transformation. I think the next 10 years we'll realize that dentists can save your life, right? It's not just transforming your life. We're talking about saving people's lives. You mentioned bacterial endocarditis of the heart.
Correct.
Before you get heart surgery, you see the dentist. Before you get an organ transplant, the dentist has to sign off on these things. So we're realizing that the type of care that we're providing is now a first line of defense. People who are walking around with no pain and they feel and think everything is okay and they're not brushing their teeth or they're not going to get regular checkups or cleanings, this bacteria is leaching into their body and now traveling to other parts of the body and predisposing them to potential heart issues.
Absolutely. You know what happens with a patient who has heart disease or a stent, comes to the dental office, he's supposed to be pre-medicated. What does it mean? Pre-medicated means you take 4 tablets of 500 milligram amoxicillin 1 hour in advance. Why? Because these bacteria, especially during a cleaning, all these bacteria are swallowed and absorbed. They go right into your heart. What happens if you forget to take the antibiotic? You end up in the emergency room. You end up in the emergency room.
Amazing.
That's how important it is.
How connected it is.
How connected it is, right? You don't end up in the emergency room for gum disease because you had a cleaning done. No, it's because these bacteria traveled into your heart and you had a stent and now all of a sudden there is a overreaction and there's a shutdown of the, it's unbelievable. Patients don't realize that. That's why when we have patients come in and we say, you have to be pre-medicated. Oh, I forgot. Well, guess what? We have to cancel the appointment.
Right.
Because nobody wants to risk
It's
any
life
chance,
or death. Yeah.
any chance for you ending up in the emergency room, So it's very, very important. The mouth is, the opening to your body, as they say,
the
right?
gateway, right?
It's the gateway, and it's very, very important what you put in there. So the future is to take certain biological ingredients to prevent these cavities. That's the future. So you eat food, you have a snack, you have a little substitute, and all of a sudden, you don't transform these bacteria into cavities.
Yeah. So let me ask you a question. Just kind of change things up a bit. If you were a patient, knowing everything you know about dentistry, how would you choose a dentist?
Well, first of all, you always want to make sure the office environment is clean, right? I mean, there is not such a thing as a sloppy handwriting, but then you're not disorganized as a person, maybe, right? So you look at, for example, the office, the environment, make sure the equipment is new, right? I mean, I sometimes still go to colleagues which have X-ray machines. Literally, they look like 1960, right? Because you can see that the white paint has faded into yellow. So I'm like looking at the details and it says 1960, right? So, I mean, who knows what the radiation exposure is? Who knows what how much leakage you have from X-rays? Because it's supposed to be in a safe environment, right? So how do you choose a dentist? You want to make sure the environment is clean, the dental office is clean, right? You want to make sure the equipment is new or newer, right? So this is not an aesthetic issue anymore. This is a health issue, right?
Correct.
The machine from 1960, right? Nowadays, we use digital X-rays, so a lot less radiation than back in the days. We do digital X-rays. The films are different and the machines are different. Everything is so much less, 92% less radiation. That's what you want, right? And of course, you want a dentist who is skilled, and let's say smile makeovers as an example, right? How do you choose a dentist, right? You can explain, you can talk, look at the smile makeover book the dentist has. And look at the smiles. And if you see all the smiles and you say, I like 9 out of 10, that's it.
Okay.
But if you don't like none of them, then guess what? Don't even try, because you're going to look like one of them, right? So if there's no smile makeover book, but you're trying to do a smile makeover, I would maybe be more hesitant, right? If you're like organic, if you're very health conscious and the dentist places amalgam or silver fillings, no problem, but it's maybe not for you.
Yeah.
So you have to interview the dentist and you have to make sure you're on the same page. You have the same philosophy, and that is very important, because otherwise you are doing the wrong thing for your body.
So what questions would you ask a dentist? And when you're moved to a new city and you want to pick a dentist, what questions would you ask the dentist?
Well, you would ask the questions, what materials do you use? Why do you use these materials? What makes you different than the other dentists? What do you do differently than other dentists do? I already mentioned ozone, right? We didn't speak about laser, but laser is amazing. You can use a laser machine, go inside the gum and clean bacteria, right? So you have to use materials which have no chemicals that could be harmful to the body. You speak about those. You speak about your preventative department. So it's not all about crowns and veneers and, cosmetics. You have to have a great hygiene department. The foundation of your health is a good hygienist. So you speak about all of these things and you explain to them what we do and what we offer and what we don't do, right? We stay away from certain things that I wouldn't put in my own mouth, and therefore I would treat you the same.
Okay. So let's talk about that. I'm going to name a couple of products and I want to hear from you. Use it or trash it.
Okay.
Okay.
Go ahead.
Listerine mouthwash.
Oi, tomorrow Listerine can call me and they ask me to become their spokesperson and offer me a lot of money. And, so, okay. So Listerine, I don't like for the following reasons. So Listerine, number one, and that's just me, right? I don't like anything artificial color. So that green and blue might be, a sales pitch for patients who say, oh, blue is mint and green is, I don't like anything chemical. So that's number one. Number two, Listerine has alcohol. When you use a mouthwash with alcohol, you actually dry out your mouth. You want to use something which doesn't dry out your mouth, right? And Listerine also is very, very strong. the old formula in particular was really strong. It was so much so that they had to dilute it themselves. So, and when
it burns almost.
It burns almost, right? And I'm not saying it can cause disease, but guess what? If you have certain spicy foods, that you eat for many, many years, that are very spicy or very hot, it can irritate the lining of your esophagus, and it can damage. It causes damage, and so it can cause precancerous lesions.
Correct.
And that's something that you have to be aware of. So does it mean you can't have a spicy food? Of course you can. But we're talking about doing something over the years for many, many years, and all of a sudden you can have precancerous lesions. So you have to be very careful. So to me, that's a no.
Charcoal toothpaste.
That's also a fade. So number one, it doesn't whiten your teeth. Number two, it doesn't work as it's an interesting concept, of course, because it's black, right? And you think you can get whiter teeth with it, but it has been proven as a
fat.
It doesn't,
and I also hear it's very abrasive and actually removes enamel.
Just like Arm & Hammer, right? So Arm & Hammer is a toothpaste which works really well. What makes your teeth look yellowish? It's the plaque, right? So there is no such a thing as a tooth whitening toothpaste, by the way. So all of these whitening toothpaste, it doesn't exist, right? You can't whiten your teeth with a toothpaste, right? They call it whitening, but they're not. They're abrasive, right? Just like you said. So what happens is you remove the plaque. Plaque is yellow, right? So when you remove it, they appear lighter, but in reality, they're just cleaner. But by doing so, you're using a very abrasive material which can damage your teeth long term. Again, anything you use long term, many years, can damage your teeth when they're abrasive.
So the white part of your teeth is the enamel.
That is correct.
Right? So by decreasing the thickness of the enamel, temporarily it'll look whiter, but eventually
they become actually more yellow. Because you have the dentin inside, and the dentin is shining through.
That's right.
And if you go really aggressively, you have all yellow teeth that cannot whiten. You can't do anything with them. Why? Because they're pure dentin. Your enamel is completely gone. So the enamel is the outside layer, the protective layer. And once that's gone, then you have to do crowns and veneers.
Oh my God. So what I'm hearing is that people should not file down their own teeth to try to make it, straight. Have you seen this fad on TikTok?
No,
where people are filing their own teeth and trying to make it flat? I mean, we're killing ourselves to save every millimeter of enamel, and then you have, unfortunately, some of these people they're actually filing down their own enamel.
It's interesting that you say that, because I have a 13-year-old daughter who just told me, "Dad, I want you to file down my front two teeth."
Oh my God!
I'm like, "What's wrong with them? They look too long." I'm like, "They look just fine to me." "No, Dad, they look too long. They look like funny, right?" I'm like, "They look beautiful. They're healthy. Well, don't touch them." Now, luckily in her case, I was able to shorten them without filing them. With Invisalign, you can actually move your teeth back into the gum,
right.
And to make them appear shorter.
Let's talk about that, because I think part of wanting to give good information to the public is doing things in a controlled manner. So if you do want to change the shape, sometimes I see cosmetic dentists do something called enamelplasty, which is in a controlled environment, done by an expert professional who also has x-rays and can see how much enamel thickness you have. So tell us about people being able to sometimes changing and beautifying their smile without porcelain veneers, without really much, by just reshaping and recontouring.
So interesting. I had a patient come in the other day, and she had beautiful teeth, beautiful healthy teeth, super straight, super white. Very natural, not a filling, nothing. And she said she wants veneers, right? And I'm like, wow, you have a veneer look, right? What do you want? You have white teeth, they're straight, they're super white, they're healthy, they don't have any discoloration. So what else would you want them to be, right? I wouldn't be able to make them look any better. She says, I want them to be shorter and more rounded. I don't like that square look. And that's true. As a female, you want a more feminine look, and the square look looks a little bit more masculine, and you want to have these, it's called embrasures in between your teeth, little spaces, so it doesn't look so 90-degree angle kind of look, right? So those are the cases that you can modify with a special dental diamond, the enamel, and we shape it and we contour it, and add some composite, a little bit to add some here, and then reduce a little bit there to give you that veneer look without doing a veneer, especially when you have healthy teeth, that you don't want to shave down. In order to do veneers, you really have to have a good reason, damaged teeth, tetracycline staining, short teeth, they have to be longer teeth have to be shorter, or like extremely shorter, maybe rotated teeth. But if you have a healthy smile, you're absolutely correct. You can fix those things with a little bit of, artistic touch of a dentist.
Right. I want to talk about another type of cosmetics that people usually don't think about, which is the gums, right? So we're talking about whitening teeth and bleaching teeth. We have a lot of patients who have pigmentation, who have dark spots, genetic predispositions to certain areas that are, inconsistent. You have a technology that I've seen in incredible cases where you can actually also fix the color and what is it, bleaching of the gums? What do you do?
So basically, think of it as like your skin, right? You go to a dermatologist and you have, I don't know, let's say acne, right? Or you have, you're not happy with your skin, right? Your skin doesn't look fresh, it doesn't look youthful, it doesn't look, its best, right? So you go to a dermatologist and they do some chemical peel, for example, right? So they place a certain medication on your skin, the skin peels off, it looks all red and then inflamed for a day or two. And then day 3, you have the most beautiful, clean skin you can imagine, right? It looks
glowing.
Exactly, because the underlying skin. So what happens is the old skin cells are dying off and you get new skin cells, of course, and it looks really beautiful. So same thing. So if you have a black gum, dark pigmentations, right? It could be from smoking, it could be, ethnical reasons, like you smile, you have a beautiful smile, but you have really dark gum pigmentations. Here's a technique that I use frequently, that we remove the outside layer of the gum, and the gum becomes a little bit inflamed, just like the skin does, and it becomes a little bit irritated for a day or two, and all of a sudden, you have the most beautiful pink gum. So I don't like to call it gum whitening because you don't make them whiter, you make them pinker, of course, right? So you change them from, and the way it works is if you have black gum and you have spots of pink, so you tell the patient, choose the pinkest area in your mouth. That's the way your gum will look like. So it's not just a random pink or anybody's, it's not your pink or my pink, So basically you have pink and you have darker gum. So we look for those pink spots, specks here and there. That's the pink you will get, because that's the actual pink that you have. Sometimes it's a darker pink or sometimes it's a lighter pink. It doesn't matter, but it's pink and it looks much nicer. So imagine you do 20 veneers, right? And you have beautiful white teeth and then you smile and you have this black gum. I'm like, it takes away a little bit from the aesthetics, right? So you do the gum pinkification, as I like to call it, and you have pink gum and, wow, what a change. And guess what? Teeth whitening doesn't last. 6 months, 9 months.
Comes back.
Yeah, comes back. It just doesn't last. We have patients fly in, from other countries. They go on TV shows here. They get their teeth whitened every 6 months. That's how it is, right? You go on a red carpet, you get your teeth whitened. Well, guess what? There's another event 6 months later, you get them teeth whitened again. And that's fine. It doesn't last. You drink coffee, certain foods stay in your teeth. You have to redo it. This gum pinkification lasts.
Oh, really?
Yeah.
Okay.
Yes, that's amazing, because once the outside layer of the gum, which is the pigmented area, is removed, you have pink gum and it stays pink. That's really cool. That's a lifetime change.
So what if, let's say someone had tetracycline staining and they have these deep internal, basically color changes that are inherent in the structure of the tooth? What do? You cover the tooth with a thin film of porcelain, which is like a glass almost.
Correct.
But a strong glass.
Very strong glass, yes.
And cosmetic. It looks beautiful.
It looks fantastic. And yes, absolutely. So it's called a porcelain veneer.
Okay.
And it's a very, very popular procedure, of course. And what it does is basically it covers all the imperfections like tetracycline, and it makes them beautiful white. Like a wood veneer, right? You can have an old piece of wood.
It's kind of like enamel, right?
You're
enamel, just replacing
the outside layer, a very thin layer. Now, here's the key. That's why you have to go to an expert when it comes to veneers. Veneers are very thin.
Okay.
right? And they're supposed to be thin, right? You don't want thick veneers. You don't want heavy-looking veneers.
Right.
They look like heavy and thick and opaque. You want them to be thin and translucent. So what I'm trying to say is, how do they last being so thin and delicate? They last because when you bond them to the tooth and you have a perfect bond to the tooth, that thin veneer is as strong as the tooth. Because
it becomes a part of the tooth.
It becomes the tooth itself.
Yeah.
It becomes the tooth itself. So the tooth is one unit. So there is no more veneer. That's your tooth.
Wow.
So can you break a veneer? If you break a tooth.
Sure.
If you see what I'm saying? So when you break a tooth, you can break a veneer. But otherwise, it's the veneer and the tooth is one part.
So what are some recommendations you give to people who have porcelain veneers to take good care of them?
Brush them like normal teeth.
Okay.
Floss them like normal teeth.
Okay.
Take care of them like normal teeth. Avoid eating nuts and carrots with your front teeth.
Okay.
Eat them more with your side teeth or back teeth, right? Not with your front teeth. And basically just enjoy them.
Okay.
They're like natural teeth. Can you floss in between? Absolutely.
Okay.
They are individual teeth. That's very important. They're not one block of porcelain. You can floss them in between. You can brush them normally. Normal toothbrush, normal mouthwash. Perfectly fine. Like normal teeth. That's the beauty of it.
Can you get cavities around veneers and crowns?
So a porcelain veneer is covering the front part of the tooth. So you can't get a cavity there. But you can get a cavity behind them, where your natural teeth are. Remember, they're not crowns, they're veneer. So that means that you have 50% of the tooth covered with a veneer, and inside or lingual, 50% is still your own tooth. So you could, theoretically, but the inside of your front teeth are very unlikely to get cavities. So usually when you get cavities, you get them on the chewing surface, not on the inside or lingual surface of your teeth, and that's why it's important to go to the dentist every 6 months. And that's why it's important to go to a cosmetic dentist, because you want to make sure the veneer is sealed very well to the tooth, so there's no micro leakage, no bacteria is going inside.
How do you know when a veneer needs to be changed?
You know when a veneer is changed, it has to be changed when you see micro leakage. So when you see brown staining around the veneer margin, when the veneer margin is turning into brown, then you know that bacteria are going inside and are causing damage inside.
There's little micro gaps where things are leaking in.
That's correct. And you can see it as a patient. It starts to stain. You can see this brown, margin, as we call it in dentistry, that covers the veneers and doesn't look so good, of course, But that happens usually after 20 years. That usually doesn't happen right away. There's a technique that you can use as a dentist to prevent micro leakage. And it's a little bit technical, but we use a certain, what do you call it? So it's very interesting. When you have cement and you cement a veneer, the outside layer of the cement, which is exposed to air, does not cure. So the veneer cement inside the tooth, which has no air, of course, because it's inside the tooth, has no air. So that's fine. It doesn't stain. But the margin, the area exposed between the gum and the teeth and the veneer, has exposure to air. So what happens is after many years, you can get micro leakage. But we use something called an oxygen inhibitor. And what it does basically is you cover the cement that is exposed to air, and it's almost like a Vaseline type material. And then when you light cure them, you can make sure everything is light cured.
Nice.
The veneer cement inside and outside, so we don't get any micro leakage.
So one of the things I wanted to ask you, which is a critical step that we talked about that you do that ensures the satisfaction of your patient's smile, so it's no guesswork. What do you do in the process of making the veneer so that there's no surprises? Are you recreating the smile with pictures? Are you waxing the tooth up? Are you creating temporaries that first can be approved by the patient? Like, what steps do you take? How many steps does this take in order to get that perfect smile?
Well, consultation first, of course.
Okay.
Then you listen to the patient and see what they want. More than often, they have a vision already. They have pictures from their past. They know what they like, right? Then you have what we call a smile gallery. So every dentist is supposed to have a smile book, booklet, brochure, and there's a gallery. Like literally, it shows you all the different designs, right? There's a Hollywood design, there's an oval design, there's a natural design, there is a masculine design, there's a feminine. You choose your design.
Right.
And you can mix and match, by the way. So you can say, I like the natural style, but the natural style has a pointy canine, right? And you can say, you know what, the pointy canine is too pointy. Let's make it more blunted. So you choose the more the youthful style, because that youthful style canine is more rounded. So you discuss this with the patient. You look at the smile book. And then what you do is you take an impression of the teeth before you start, and you do a proposal from the lab. It's called a wax up. So basically you're showing them a presentation of your teeth, your smile, with the veneers, how they would look like if you proceed. And then you see it in a three-dimensional model, which I like a lot more than photos, by the way, because photos are so easy. You can make anything look good in photos, but it's just a photo. It's fake, right? It doesn't mean it can be achieved. But if you have a wax up, a three-dimensional model from your teeth, your arch, your gum, and you make it into a veneer case and you show the patient, this is how you will look like, that's how you know.
And then they basically see that in three dimensions before you.
Exactly. And guess what? So the day you do your veneers, you need temporaries, right? You need some sort of temporaries for 2 weeks or less. And guess what? You use that model of those veneers that you created a week earlier, put them on, and let the patient go home.
Amazing.
And then the patient has a preview. And when your patient says, I want rounder teeth or shorter teeth, there you go. You just got it.
You can modify the temporaries until they're happy.
Until they're happy. You can modify them a few times, and then you take an impression of those temporaries and you tell the lab, go ahead, copy this, but just nicer.
Amazing.
So it's a process, and it's an art, right? So you're at 0, you want to get to 100. So you use photos. You're 50% there discussing what you want and what you don't like. Then you use the wax up and you're almost 95% there, right? And you place that wax up or those temporaries in your mouth and the patient says, wow, you nailed it. Or you make some small modifications until you're happy. And then you copy this and tell the lab, this is what the patient wants.
Amazing. So the last thing I want to ask you is we talked about restoring, transforming. I want to talk really briefly about preventing.
Mm-hmm.
One of the things that I'm a huge proponent of is cleanings every 3 to 4 months, right?
Correct.
One of the things I'm a proponent of is not drilling teeth when the cavity is super small and giving it an opportunity to remineralize. In fact, I give my patients things called remineralization trays. I give them MI paste. I tell them, wear this for a couple of minutes every day, and we can actually reverse some of these without having to drill your teeth. What type of prevention techniques or recommendations do you have? And what do you recommend people do to prevent problems before they begin?
Yeah. So preventing, of course, starts with your cleanings, your x-rays, your consultations with the dentist. I like what you just said, every 3 to 4 months. 6 months is
too long.
It's too long. It's too long. So that's number one. If you see a small cavity, right, after your 3-4 month recall, and you explain to the patient, here's your cavity, keep on brushing, use some MI paste, keep that area particularly very clean. Guess what? If the cavity doesn't appear, at the very least, it doesn't grow. And guess what? It's called arrested decay. It can be arrested or stuck in that stage for many, many years, maybe even decades. Right?
Wow.
It doesn't grow to the next step where it becomes bigger and bigger and reaches the dentin, and then you really have to fill it. So not every cavity has to be filled. A small cavity shouldn't be filled sometimes, because in order to access the cavity in between your teeth, right, you have to get to the cavity. You have to open a box, we call it a box, to get to the cavity in between your teeth. And we have to prepare the teeth in a certain way. Well, guess what? You're removing as much tooth structure as if it is a full-blown cavity.
Right.
Might as well wait.
Right.
Keep an eye on it. And maybe next year, it's still not required to do those fillings. And guess what? And when it really reaches that stage, maybe 10 years later, 5 years later, then you can do the filling. Because drilling oftentimes requires a lot of, opening of the healthy tooth structure in order to access the decay. So it's very important to not fill every cavity you see, and sometimes keep an eye on it. Take a photo, explain it to the patient, and say, look, this is what you have. Keep an eye on it. I see you in 4 months.
That's amazing. So how do you, if someone wants to reach out and become a new patient of yours, where do they find you? Where are you? Are you in Germany? Are you in Dubai? Are you in Beverly Hills? Where's the best place to find you?
Well, the best place where I'm 99% of the time is, of course, is in Los Angeles. My office is on South Beverly Drive, 241 South Beverly Drive.
Okay.
Which is next to Earth Cafe, world famous Earth Cafe.
Okay.
Right? If you don't know Goodman, at least you know Earth Cafe, which is very, very famous and popular, of course. So on South Beverly Drive. Now, the reason I have Germany on my website is because I was born and raised in Germany. I got my dental education from Germany. I used to work in Germany. right? Düsseldorf, Cologne. I don't know if you know those cities.
Mhm,
Beautiful
mhm,
cities.
mhm.
So, you know, if a patient lives in Germany and I happen to be in Germany, you know, I would go there, work there, and work on some patients there. But it's rather rare. So Germany was the past. I moved to America. I'm here full time in my practice in Beverly Hills. But I do get invited to Dubai and Abu Dhabi as a guest dentist. So basically, some patients call me and say, we have our own facility. We have our own staff, believe it or not. You bring your equipment, you bring your know-how, and your lab, and we do the magic in Dubai. So that's how it works. When I work in Dubai, it's not that I have an office there full time. There is a facility that I can use, and patients who come, I see them, I treat them, and they have their own assistants. You know, it's amazing. If I have one assistant in Beverly Hills or two, they have 5 assistants.
Right,
You know,
right.
they massage the patient's feet, they give them a back massage, the real VIP treatment. Like, you know, it's unbelievable. It's a better service than you can imagine. But I do my dentistry. I bring my, you know, American, of course, you know, supply, equipment, medication, you know, all of this. And then we bring my lab technician, or my lab technician is in Germany, because Germany has a smaller, what do you call it? Shipping,
Mhm,
you know,
mhm.
time. So we do veneers, we send them to my lab in Germany, and then I send them back 4 days later. We cement them in, and voila, we bring
Amazing.
Beverly Hills Dentistry to the Middle East. So Dubai was very, very engaged, especially before COVID. You know, during COVID, of course, it died out. But I'm still going, and I'm still lecturing in the Middle East. Like I was invited to lecture in Bahrain, small country, beautiful country. So amazing experiences.
Amazing. Dr. Joseph Goodman, thank you for blessing us with your presence today, local dental hero, and hopefully we'll have you on again in the future.
Thank you. Pleasure chatting with you.
Thank you.
Thank you.
It was a pleasure.